Americans have been hit hard by COVID-19. They, in fact, are facing disparities similar to the Black and Latino communities during the health crisis. 7,000 members of the Navajo Nation have tested positive for coronavirus and 335 have died. The Connecticut-based organization Americares is responding with much-needed PPE and medical supplies. So let's bring in Sambhavi Cheemalapati. Oh my goodness, I know I messed that up. She is the Associate Director of Emergency Response at Americares. Thank you for joining us.
Thank you for having me, Betty.
Okay, so there has not been much organized reporting on the toll of COVID-19 in Native American communities. However, your organization has been learning about the disparities and responding, and you are starting with the Navajo Nation. So what is happening in that community?
What's happening is that we learned through the disaster response agencies and organizations that we collaborate with that there were higher rates of infection and death within the Navajo and Hopi and other Native American communities. And so what we did is we reached out and offered support. What we've learned is that severe cases are being moved off of reservation for additional treatment within public hospitals in the states. And there's a lot of concern about how congested those hospitals are and whether or not that's going to create additional barriers to care.
Give us an understanding of the crisis on these reservations across the U.S. How dire is it?
It's quite significant. The problems that the Native Americans communities face are generational in nature. 1/3 of these communities lack access to water and electricity. 43% of the population of the Navajo Nation particularly lives within poverty. They live in multi-generational households, so you've got young people and more at-risk populations living together, which is really not a good situation when you're talking about COVID-19. And finally, they have higher rates of things like heart disease or diabetes and high blood pressure, things that we know result in more severe and negative outcomes if you do become infected.
So how are you helping? You mentioned supplying with PPEs. Are there other areas in which you're trying to provide help as well?
Absolutely. So our initial shipments were to the Hopi Navajo tribes as well as to the Salvation Army and Catholic Charities, all of which are working with these very vulnerable populations. We've provided shipments of personal protective equipment, infection control, prevention and control supplies, as well as hygiene items, shampoos, hand sanitizer, body wash. So what we're actually offering now as well is technical support. We've actually recently been in conversations with the Navajo Nation about infection prevention and control trainings, preparedness trainings as we continue with this outbreak, and mental health and psychosocial support as health workers, first-line responders are all facing stress and anxiety regarding the outbreak that's going to continue for many, many months to come.
Is there something we can all learn from this? Because as I understand it, Native Americans suffer many of the same chronic illnesses that we are seeing in the Black and Latino communities as well, and that being what? Diabetes, heart disease, asthma, things like that.
I think that this is part of a broader conversation regarding disparities and systemic issues across the country. And within these communities particularly, there's insufficient access to nutritious food. As I mentioned, insufficient access to critical things like running water and electricity. And there's also mental health issues related to the economic situation that also make people more vulnerable. And until we actually think about public health in a more comprehensive way, I think we're going to continue to see these types of issues.
Yes. All right. I'm going to get it right this time. Sambhavi Cheemalapati, correct?
Thank you. Perfect.
Yes. Thank you. We do appreciate your insight, and thank you for your patience with my pronunciations. All right. We appreciate what you're doing.